Abu Dhabi Global Health Week. I'm Dr. Stephen Grobeyer. I'm the chair of the Cancer Institute at Cleveland Clinic Abu Dhabi, Fatma bin Mubarak Center. And we're learning a lot at this conference about new treatments for cancer. But the thing I want to talk about today is some of the efforts and the new things we're doing to support the care of our patients who, as they go through cancer treatment, are going through one of the most difficult times of their life. So one program we're launching, which is really designed to really improve the supportive care of our patients, is a wearable called a bio button. And we're starting to use this in our patients who are receiving cancer treatment. The patients receiving cancer treatment these days largely are under our care for a short time, where they come to the center, they get the treatment, and they go home. With the new technology we're employing, we're going to have the ability to monitor patients constantly, and we'll be able to monitor them at home after they leave our direct care, so we can determine if they're having any issues at home, and we can intervene earlier to prevent more substantial problems. So this is a great example of leveraging technology to really improve the care of cancer patients, and we're going to be using it both in our patients receiving chemotherapy and radiation therapy. So we're really optimistic about what this will do for our patients. Another area of very exciting advancement is in addressing the need to reduce the side effects of chemotherapy. Traditionally, there were two side effects of chemotherapy that were very difficult for patients to handle. One was hair loss, and the other is there's certain chemotherapies that cause a damage to the nerves. They treat the cancer, but they cause nerve damage. So what we're doing now to prevent these two issues is, one, we put something called a cool cap on patients when they're receiving chemotherapy. And it's been shown scientifically to significantly reduce the amount of hair loss that patients have during chemotherapy. And this is a big advantage for patients because as I said, one of the things they most fear is hair loss during chemotherapy. And then finally, we've adopted a system where patients receiving certain chemotherapy can have a cooling system put on their hands. And by cooling the hands during the treatment, they will have a lot less nerve damage and a lot less neuropathy after the treatment. So these are just some of the things we're doing to not only improve the treatment, but to make the treatment easier for patients so they can recover and go on to a healthy, happy life after treatment.